dorsi. So we know that this muscle comes in from caudal. Again, focusing on where we can palpate this muscle for trigger points. So if you have the caudal border of the scapula here, this triangle, this is the triangle where we can palpate the muscle belly itself. All the rest caudal is more fascia. This is where we can palpate the muscle belly. So this is often where we can find trigger points in dogs that do a lot of pulling with the front limbs, or dogs that have hind limb problems and they pull up when they do transitions. So this is where we can palpate those. So if we do palpation like this of the latissimus dorsi here, so, and this is all the only muscle that is here in this area between the skin and the ribs. So if you do the palpation over here, then we also will get this twitch response or reaction of the dog. And always do gentle muscle palpation. Don't try to pinch with your nails. You don't want a reaction of the dog. Often you find trigger points, twitch response, or the muscle itself that contracts. That's already a positive test. Don't wait for the dog to turn around to see if he's painful. So we know teres major. This is a muscle belly. It goes to the latissimus dorsi. This is a muscle belly. We know it goes to the medial side of the humerus on the tuberosity of the teres major. So actually, it is on just the opposite of the deltoid tuberosity. So if you're able to palpate the deltoid tuberosity, just opposite to that, but on the medial side, we're on the tuberosity of the teres major, and there we have the tendon attachment of the latissimus dorsi with the tendon of the teres major of it, because this is the teres major tuberosity. That brings us, of course, to the teres major. So we've seen in active sporting dogs, if they do the slip movement, that they can have strain of the teres major. So the only place where we can palpate the muscle belly is at the caudal angle of the scapula. So this is where we can palpate the muscle belly of the teres major before it goes to the medial side and it goes underneath the triceps tendon, triceps muscle. So if we lift the front limb, then I can palpate on the medial side, where my fingers are right now. Here I can palpate the tendon attachment of the latissimus dorsi and the teres major. And it is more a V-shaped tendon attachment because the latissimus dorsi comes in like this, and the teres major comes in like this. So if you have really experienced hands, you should be able to palpate this V-structure tendon attachment over there. Of course, if you have a strain of one or the other muscle, this whole area will be painful. So attachment of palpation over there will be painful. So you will have to do flexibility tests and palpation of the muscle belly to see which muscle that is painful. Okay, then subscapularis muscle on the medial side of the shoulder joint. We're only able to palpate the tendon attachment on the medial side. We're not able to palpate the muscle belly because it's on the medial scapula. We know that we have the tendon attachment of the subscap muscle, but we also have the medial ligament over there, and we also have the medial joint capsule. So we have the medial ligament that is more, we have first the joint capsule, then we have the medial ligament that's more vertical on the joint line, and then we have the subscap tendon like this that is more angled. We're not able to palpate or differentiate between those different structures, but know if you have penile palpation there, it could be one of the three, or it could be all the three. Hi. Hi.